Hi, I am Dr. Subhash Chandra, the interventional cardiologist and the director Narendra Mohan Hospital and Heart Center at Mohan Nagar, Ghaziabad. Today I'll be sharing my views with you on the coronary artery disease, what we call as a heart attack in the common parlance. The heart attack is one of the biggest challenge which the Indian society is facing now, and especially when the disease is on the decline in the Western world, where it was the topmost killer at one point. It is on the rise in this part of the world, where India is the leader. As for the incidence and prevalence of this disease is concerned, it was about 20 million deaths in the year 2000, according to one estimate. And the guess is that by year 2015, it is bound to take 60 million deaths in a year. So that's really alarming. We have to brace up to face this challenge as doctors and as society. Before I go on to explain about heart attack, we know that our heart is a thumb-sized, fist-sized organ which lies in the center of our chest. There are coronary arteries running on the surface of the heart, and these arteries are responsible for supplying the nutrients and oxygen for the functioning of the heart. And therefore, these are the most important arteries of our body. Now, whenever there is a deposition of fat or cholesterol inside these arteries, as you can see here, that is what is responsible for causing heart attacks. Now, the commonest risk factors causing deposition of cholesterol in the arteries, or what we call as atherosclerosis, is the lack of exercise, erratic lifestyle in terms of eating junk food, or food which is full with saturated cholesterol like butter, ghee, and a lot of non-vegetarian food. Smoking is one of the biggest risk factor in the Indian context. And of course, coexisting diabetes and hypertension, and nevertheless the genetic factor. Some of the individuals are predisposed on account of inheriting it from their parents. So they have to be careful. The disease normally appears at the age of 40 or so, but in the Indian context, it has started appearing almost a decade earlier. More and more younger people are being affected by this disease in our country, and that is largely because of the erratic lifestyle. And now, very commonly we are asked by patients that what are the symptoms of heart attack? The commonest symptom of heart attack is the pain in the center of the chest, which usually radiates to your neck or jaw or to the left arm. This is usually accompanied by sweating or feeling of dizziness, and sometimes a sense of impending doom. And whenever you feel such symptoms, you must see your doctor or go to the nearest hospital. Sometimes the symptoms like pain on the left side of chest or the recurrent acidity are confused with the heart attack symptoms, and they also need to be resolved with the help of doctor and conducting certain investigations. In patients who are diabetic, or especially females, when they suffer from heart attack, the normal telltale signs or symptoms are not present, and they have to be careful because recurrent belching or acidity could be a symptom of heart attack, and it should be shown to a cardiologist. Now, when a patient of chest pain comes to us, we normally take their ECGs. If the ECG is showing a clear-cut sign of heart attack, then these patients are immediately subjected to coronary angiography, which has become a very simple tool to test as to how many arteries are blocked and how best they can be treated. But if ECG is normal, in those cases there are certain other battery of investigations which can help us reach to a particular conclusion, like treadmill test, echocardiography, and various other stress tests. Now, once the disease is ascertained or diagnosed by doing an angiography, then the process of treating disease is very simple. These days, we treat it by the process of angioplasty, and especially in the wake of acute heart attack, where it is life-saving. We pass in very fine wires through the groin or the hand, and we reach to the heart and go into the coronary artery. Over this wire, we place a balloon and inflate the balloon from outside so as to clear the block, and in the end, we put a stent, which is actually a metallic piece of scaffolding which props up and keeps the artery open forever. These days there has been a revolution in the stents, in the sense that there are drug-eluting stents available in market, and these drug-eluting stents have the advantage that their reblockage rate is much less than the bare metal stents, so much so that they at times fare better than the bypass surgery. Now, if the blocks or blockages in the arteries are widespread, there are 3 arteries, if all the arteries are involved and they're extensive, in those cases bypass surgery is perhaps the best option and much more lasting option. In the bypass surgery also today, there has been a revolution in the sense that doctors or the cardiac surgeons have been using more and more arterial grafts rather than taking veins from their legs, which have a tendency to block early. And these arterial grafts, they go a long way in keeping the arteries patent, and patients who has had bypass would live for 20, 30, 40 years. So revolutions have happened on both the fronts, as I told you, the drug-eluting stents and the bypass surgery. In the end, I would just put in a word of caution that how best we can prevent the occurrence of heart disease. And as I narrated in the beginning, that the risk factors have to be tackled one by one. You must lead a very healthy lifestyle, and that would mean that you must not smoke or chew tobacco in any form, because that is the biggest risk factor in the Indian context and everywhere. If you are overweight, then you must try hard to reduce your weight by doing regular exercise. And regular exercise would mean that you must undertake a brisk walk lasting for 30 to 40 minutes at least 5 days in a week. Regarding eating habits, you should be very judicious in consuming fat. You must try and take as much as non-saturated fat, which comes from mustard oil or saffrola or canola or refined oils. Rather, you must avoid deshi ghee, butter, and all the saturated fat. You must try and avoid the junk food like pizzas, the burgers, which have very high quantity of saturated fat and preservatives. If you are a diabetic, then you must submit to a diabetologist or a doctor who can control your diabetes strictly and keep it under check, because diabetes is one of the very big risk factors in the Indian context, so much so that people today say that India is emerging as the diabetic capital of the world. And as you know, diabetes and heart disease, they go hand in hand. So diabetes has to be strictly controlled. If you are hypertensive or have blood pressure, then keep it regularly checked up and keep it under control with the help of drugs. So avoid unhealthy food, regular walks, keep your weight under check, diabetes, no smoking, blood pressure control, and last but not the least, you must lead the least stressful life. Today there is so much of stress in the metropolitan life that the incidence of heart disease in the metropolitan cities is starkly much higher than compared to the villagers, and that has to do with the stress. So pollution and stress have their own role in playing in the heart disease. Thank you.